Minister, this issue is about as serious as it gets. It represents a fundamental failure of professional care for spina bifida patients, and it has been an absolute nightmare for the parents and indeed the children involved, and one can only imagine what they're all going through now. It is a betrayal of trust on a scale that is hard to imagine or indeed quantify. We know that of the 16 case files reviewed, 13 patients, 81.2%, required further unplanned surgery, and one of these patients, who had multiple procedures, unfortunately passed away. And indeed, my thoughts and prayers are with the Carter family at this very, very difficult time on the loss of their daughter. How on earth could a situation like this arise, whereby unlicensed devices made with non-medical parts were able to be implanted into highly vulnerable and complex needs patients? What level of serious failures had to occur for this to happen? Where were the safeguards, and where were the processes that should have put a halt to this sooner when the initial concerns were raised by staff? I understand that the surgeon at the centre of the external review at Temple Street Children's Hospital has been referred to the Medical Council and is not carrying out surgeries while investigations are underway. That is the least and the very least that should happen. Quite frankly, to read that the overall infection rate for these cases was 73.4% and that 9 of the 16 cases, 56%, had mechanical complications is like reading a report from a third world clinic. This is a tragedy that must never happen again, Minister, and it is absolutely shameful that it has occurred. Go Margaret.